10 years ago, in the United States Senate, members of the Senate, Republicans and Democrats, came together. And they said, you know, the cost of health care for working families is going up too much for working families. And you know something else? Too many of those working families are losing their health insurance. And in a bipartisan way, 10 years ago, we passed the CHIP program, Democrats and Republicans together. They said the Medicaid takes care of the poorest children, but hard-working men and women have difficulty. If they are only going to be having $15,000 or $20,000 a year, or $30,000 a year to afford the $10,000 premium that they were going to have to afford to insure their children. So the Congress came together, and Democrats and Republicans said, we are recognized that this is in our national interest. It's in our national interest, and it's, most of all, it's in the children's interest. And Republicans and Democrats understood very well one fundamental concept, and that is the test of a greatness. The test of greatness for a nation is how it cares for its children. How it cares for its children. And on that issue, we put children first. We put children first. This is about a mother or a father tossing and turning all night long when they hear a child cry in the night and wonder whether that child is $423 sick, because that is the average cost in the United States of America for a mother or a father to bring a sick child in the night. Those mothers and fathers cry themselves asleep at night because they are wondering whether that child of theirs is going to get better or whether it's going to get sicker. And they haven't got that $423. And they have to look out after other children. So this is an issue not only for children. This is not only an issue for parents. This is a moral issue. It's the kind of decency. It's a fairness issue. And Americans understand fairness. Americans understand fairness, and that is what this whole health care battle about. It's fairness for our children. Don't you children agree? Yes. One very important factor. I, for one, am tired of being on the floor of the United States Senate, where virtually every member of the United States Senate has a good health insurance program. And it is subsidized by each and every one of you that are out there. 72% of the health insurance program for every member of Congress is paid for by the taxpayers of America. By the taxpayers of America. And their children are covered. And I think if it's good enough for the members of Congress and their children, it ought to be good enough for the children of working families all over this country. Any time that this president that lives over in the White House wants to go to a medical facility, he can go to the Walter Reed Army Hospital or the Bethesda Naval Hospital. These are run by the military. Do you understand? They all say, the White House says, we can't have health care for the children because it's run by the government. Who in the world do you think runs the Walter Reed Hospital and the Navy Bethesda Hospital that the president goes to? It's run by the Defense Department, and they find it quite satisfactory. And just as any member of Senate can go downstairs and go to the dispensary, we don't get a bill. Any member of the Senate can go to Walter Reed or Bethesda Naval Hospital. We don't get a bill. We get paid $160,000 a year, and yet we're not trying to exclude the children of those that get $160,000, but why do the Republicans want to strike a program that's trying to help men and women and the working families of America that make $35,000 and $40,000 a year? That is wrong, my friends. That is wrong. So we ask you to join with us. We have the support, Republicans and Democrats in the Senate. We're working in the House of Representatives with Congressman Dingell and others. We're working together, but we need to hear from the American people. Are you going to be with us? Are you going to fight with us? Are you going to be on our side? Are you ready to fight? Yes. I want to know whether you're ready to fight. Yes. Give them one big yes. There it is.